Hi, everybody. Thank you for joining the Facebook Live event tonight. It's so nice to have Dr. Jake Lang on with us tonight, the dry eye expert. Thank you, Dr. Lane, for coming on.
Yeah, thanks for having me. It's nice to be here with everyone.
Yeah. So you're the dry eye expert in the industry. Can you just give us some, background on you and how you got into dry eye?
Yeah, so I'm Jake Lang. I'm an optometrist on the east side of the Twin Cities metro area, Minneapolis type situation. So I grew up here, went to college at the University of Minnesota, then Boston for optometry school and a cornea and contact lens fellowship or residency, whatever you want to call it. And I did my residency there. That kind of drew me into cornea and contact lenses. And from there, bounced around a little bit, moved back to the Midwest, and then kind of developed this anterior segment and dry eye practice just because of the huge demand. All these patients that, were being underserved or undertreated in regards to their ocular surface disease. And so, I've filled the need, and that's kind of how it developed over time. And there's just been this huge explosion of technologies and drugs. And so just like why I got into cornea and contact lens with all the advancements in contact lens and sclerals and topography and everything like that, there's just so much technology and fun new stuff in the anterior segment. I've found it pretty exciting and fun.
Yeah, I think with COVID now, there's been an influx of dry eye. I've seen a lot in my practice as well, and being on screens all day. Have you seen like a big increase in dry eye and patients really coming to you with dry eye, knowing what dry eye is and looking for, resources to help them?
Yeah, for sure. It's a very different world we're living in. So, I think the big thing is just all this sudden change. And that's, change isn't always good for people. Whether it's, all the time now working from home and not being able to get up from their monitors as easily, or see people in person and having to do these meetings, or these evening Zoom calls and Zoom meetings as opposed to being at a meeting or a table with people. I think there's definitely a huge increase in screen time, and I've seen a lot of that that sort of dry eye for sure. That blink rate going down 4 or 5-fold. On the screens like we are now. So everyone in the audience, please remember to blink. That sort of thing has been huge. The people wearing masks and having their glasses fog up and having that hot air flow up into their ocular surface, definitely a different airflow that's been affecting dry eye as well. So I think you can't get away from it, whether it's masks or screen time, it's out there. The other big part of that I've seen is a lot of, mental health things too, that sometimes we're having patients that are having more anxiety and more depression. And when you're not feeling good, your eyes aren't feeling good too. So it's been hitting us from every angle, I think, throughout eye care.
Yeah. I think a lot of doctors, when they want to go medical model, I think the easiest way to go medical model is dry eye. How did you get started? What can you give some tips to doctors to get started with dry eye? Because I think it's a great entry point, and there's not a lot of things you need to really start, right?
For sure. Yeah. You need a slit lamp and good communication skills. I mean, really, that's it. Vital dyes are great too. And then you can get into all the sort of fancy stuff and check osmolarity and inflammatory and measure meibomian glands and tear breakup time. But, you can really get a long ways. We've only had, simple things like fluorescein and Schirmer strips for, 15 years. And now we've had this big advance. But getting started, definitely don't, need to jump into the deep end. I think just acknowledging what you're seeing and looking for disease is huge. So that would be my recommendation is look and tell the patients what you're seeing. I think you'll find patients really engage and say, oh, is that why my eyes are watering? Oh, that's what's going on. And then you can take it from there. So once you build that kind of repertoire of skills and discussions, it just snowballs.
Yeah. So once doctors get comfortable and start building that and start to snowball, what are some low cost investments doctors can use in their practice?
Yeah, I mean, you know, the easy things again, lissamine stain, lissamine green is definitely underused, and having that around is great. But then, you know, I think the next big step is it's such a visual profession that we're in, that, you know, a picture's worth 1,000 words, right? And I think that strikes home with doctors and patients. I think that's why we've seen all this huge growth in regards to OCTs and topographies, but also meibonography. And so, you know, a slit lamp camera or a slit lamp attachment for your phone can be a huge addition, and let you demonstrate to your patients what you're seeing. Say, you know, I'm seeing something that's concerning me. There's something going on here I want to show you, and I'm going to document it, and we're going to treat it, and we're going to watch it get better. So, you know, I think that really engages the patient and gets them involved and invested. And if you have an invested patient, someone that's going to help you do your job, that what more can we ask for as doctors? So I've been using my phone more and more when I'm in our satellite offices, and in our central office, we have a really nice, you know, camera and take videos and all that stuff, which I really love doing. One of my passions is pretty pictures of eyeballs. And maybe my son would argue with me. He does not think they're pretty. Every time he's looking over my shoulder, he's like, "Oh my God, Dad, eyeballs, ew." I don't know if you get that at home too, Maria, but
I do. They're kind of sick of it. Yeah. They're sick of it.
yeah,
So.
but yeah, pictures worth 1,000 words, and AOS has some great technology that I've been using more and more with my patients, with my staff, but also with my colleagues. You know, got a couple lectures this weekend that I'm going to be using some of their technology to kind of highlight what I'm seeing, what I'm talking about. Also, Modern Optometry is a great little journal. I'm going to be posting a back of the journal article about this pathology or that pathology based on pictures. So I actually have some pulled up here. I'm going to try and show you guys if you got a second. So this one is the one I was just working on. I'm going to try and turn you around here. So there's that eyeball, if you can see that. It's a patient with bullous keratopathy from multiple glaucoma surgeries and everything like that. But then when we throw it in the enhancer, so when we throw that into the enhancer for AOS's fluorescein thickness analysis, so they actually have an analysis where you can measure how thick the fluorescein is in places. So, you know, if it was a steep fitting RGP, you'd see a lot of pooling, and it's going to measure that pooling in a high-tech way and give you kind of a picture's worth 1,000 words. So this is kind of what it looks like in a topography type view of that bullous keratopathy. So you can see all those little bullae, which are raised and elevated spots, don't have any fluorescein on them. And then the gaps between them, and actually up here, the eroded bullae are staining, and so that fluorescein is thicker. Sorry about the camera back and forth, but you can just see that change and say, like, look at all these little blisters on your eye. Oh my gosh. And they even have a 3D view that you can see there. So they have some really cool ways of analyzing these pictures, in addition to things like grading of corneal staining, like how much staining are you seeing on the cornea, how much redness. They can actually put numbers with some of the things we've been measuring clinically, which hasn't been an easy thing to do. I know we all have our grading scales, you know, 1, 2, 3, 4, but actually to put a number on this is pretty cool too. You can see this one. We can see some of the staining there, but then also central staining, inferior staining, numbers put onto that stuff. So kind of fun to have a number there. And when you see a patient come back with that, you know, huge abrasion that all of a sudden is resolved, and you can say, look, you know, you had a third of your cornea gone 3 days ago, and look at how much this is healed. Your bandage lens did a great job. Look how much better you're doing. I think, you know, that strikes home with the patients that, hey, you are their doctor. You're going to take care of them, and you're using, you know, the newest and best technologies to help integrate their care and take care of them. And I've never had a patient say, like, oh, I don't think this technology you're using is cool. they always like to see their eyes and stuff like that. And sometimes they're grossed out like the kids, but they seem to like it.
Yeah, I think for our listeners though, like I have incorporated this into my practice, and I was starting off, right? So I'm trying to kind of grow and do this, and this was an easy way to do so, to kind of integrate technology. And I started with just like an iPhone on a slit lamp, right? And then you could take images, and then you can, put it into this software, and I can explain to patients, or patients come back, they say, I haven't noticed any difference in the treatments that you get, and you show them the pictures, it is a wow factor, but it also helps you as well to make sure that they are noticing changes. And so for me, it's been good to kind of get entry point into dry eye and start as well. And it's been affordable compared to buying, this high cost technology, as I'm starting to grow this specialty in my practice.
Yeah. I've been doing that more and more too, using my phone, like I said, in the satellite offices. And it's kind of nice that it's this web-based software. So if you see a patient, do you do this a lot where you see a patient in one office and then you see them for follow-up in a different office?
I just have it in one of my office right now, but that's a good point, right? So doctors have multiple locations, so that's very good. And then during COVID, I used it like for telemedicine. It has an extra option. Did you do that in your practice?
Yeah, we did a fair amount of it during lockdown and things like that, and with follow-ups and moving forward. We have phased out of that, I'd say, a fair amount, just because we're able to see patients in person. But they do have some cool software for telehealth, for video calls, and for requesting images for your patients. So like, hey, I saw you for that subcontium or whatever. Send me a picture of that. I want to see how that looks. So really some technology that is moving things forward and making us think outside the box a little bit.
Yeah, I think so. I was thinking more of it like AI for dry eye, right?
Yeah.
So some of that approach. I know we're thinking of that as optometrists. We see that in retina and things like that. But when I saw this, I said that's like AI. So it kind of advances the discussion with the patient, right? But it also helps with your treatment and diagnosis, and kind of keep them compliant, I think, too. Have you noticed patients being more compliant with this software, just following up and taking your recommendations instead of how they feel per se?
Yeah, I think that engagement, when you can show them what you're talking about, I think that their compliance increases greatly. Just like when we show them a visual field of the glaucoma loss, they're a lot more likely to say, oh yeah, this is bad, I don't like that, or their myogranopathy. There's so many things in the anterior segment that we can show them and get them on board with, what, we got to deal with this before it deals with you. We got to get ahead of this. So
yeah, I think from the beginning, when you said all doctors need a slit lamp and be able to communicate, this, I think also it makes, dry eye conversations impactful, right? So they kind of understand too. So
yeah,
how
this isn't
you
just
use this?
this isn't just how do your eyes feel. This is, hey, look, I'm seeing damage to the surface of your eye, and you only get two of them, right?
Yeah.
So showing them that damage or that change is impactful.
Yeah. And you feel like, advanced ophthalmic system reports are easier for conversations and things like that, and patients to kind of, take in the treatments and do what they're supposed to be doing?
Yeah, I think it's a very easy platform to use, and for exporting images and sharing images with other providers, that I've been really happy with how easy it is to use.
Yeah. What else do you think that doctors can benefit from this? Is it increased patient reporting for dry eye symptoms? What is a great opportunity for doctors to kind of, share with other ODs or other doctors in their community?
Yeah, I think education of our peers is one of my passions, and I think of others too. If we can show and better demonstrate to each other, kind of the things we did as a referral center. If you're sending me patients, to send this back and say, hey, thanks for sending me this patient. Here's what I'm seeing. This is what I'm looking at. It raises all boats, right? But also other providers too. I mean, you get a fair amount of referrals from urgent care, or somebody that was seen in the urgent emergency room and given gentamicin, and now they're looking to you for a second opinion to, share that and say, hey, this is what I saw. Elevates your status with those other doctors, and also helps educate them so they can use you as a resource, look to you as an expert in the future.
Yeah, I think my opinion is I think something like this is going to be a new trend in eye care or in medicine. Do you feel like this is something that's just the beginning to kind of for dry eye or anything in optometry, software and analyzation and things like that?
Yeah, I agree. And in dry eye, especially, and working with colleagues because they're going to have different specialists that they're seeing for this and that, and just the continued specialization of medicine. But also, yeah, I think more and more we're going to have the ER doc saying, "Hey, can I send you a pic of what I'm seeing?" Or how could I send you a pic of what I'm seeing? And working with those providers to say, "Oh yeah, don't worry about that," or "Oh yeah, this patient really needs some help emergently," is just going to take care of better patients, especially as rural communities like the one I grew up in don't have as many providers and still have that demand for high level care. Hopefully, we can give that to patients in rural settings or more remote settings by using technology.
What is your practice doing differently from other practices, and what can we take out of it from this conversation so we can grow our practices as well?
Yeah, I think we are trying to embrace technology, whether it's AOS systems or new drugs and new procedures. I think that's one of the big things that I've always loved doing, and it's kind of been taught to me by the leaders that I worked with coming up. My mentors, if you will, is embrace this technology, that it's going to help you. It's not going to go away. And so embracing that technology has been big. We've kind of developed a dry eye clinic, and we continue to evolve that clinic. It's kind of, I would say it's on version 2.5 already, where things continually evolve, but trying to dedicate some time and space to that and saying, hey, we realize these patients have needs and we can best serve those needs in a specific clinic, just like a retina clinic or a glaucoma clinic. But an ocular surface disease clinic is something that we've been growing and evolving and continue to. And I'm excited about some things we're shaking up and moving forward with.
Yeah, I think a lot of doctors want to go into the medical model. And like I said at the beginning, I think dry eye is an easy way to get into it. I think a lot of doctors are comfortable with it. And I think that embracing technology with dry eye is a great way to advance your clinic after you get comfortable with the basic things. And I think AOS is a great way to, embrace that technology and bring it in, and then use that as a stepping point for other technology in your practice as you continue to evolve that practice. But it's also a great way to bring in telemedicine into your practice if you choose to.
So Maria, what have been some of the challenges like you've seen as you kind of growing this medical model and growing dry eye in your practice? What kind of the big hangups for you that you've seen in kind of your setting?
Sure. Yeah. So one of the things is kind of like educating staff, getting staff on board. Some of the things is insurances. Some doctors that I talk to throughout the country, they can't get on certain panels. The other thing is if in a corporate setting, there's space requirements and things like that. That's been another challenge or so. But something like this, it doesn't take any space, right?
Yeah.
It's just a matter of doing it. And a lot of doctors are frustrated with, managed care plans. So this is kind of one way to kind of transfer it over, right?
Yeah.
So that's been a good way to kind of evolve the practice, but also patient retention, right? So you have your record. I remember something going way back. I came back to you because you had a retinal picture, right? We take retinal pictures all the time now. And it was routine screening, right? They came back because you have their picture. So this is the same thing. Like you take that extra step. It's not really a big extra step if you have your tech trained or things like that to kind of show them and educate them.
Yeah.
And it makes your job easier, but it's also kind of retain those patients. There's so much distraction out there, from online and other competitors. There's kind of ways to do that. So, it's important, I think, to do this and kind of evolve. We do a lot of optometry is like a legislative profession. We do a lot to kind of advance our scope. We're educated on it. We're trained on it. We should just go and get it. Go do it.
I know.
right?
I agree. I'm all for it. Like, we should all be doing this stuff. And there's definitely no lack of demand. Like, there's plenty of patients for everyone, and plenty of dry eyes for everyone, and increasing, like we were talking about. So yeah, that's interesting though, that I think that's a great point about like having that picture and having that baseline, and patients are going to come back to you for that. Like, yeah, I remember we did that. Now we have this relationship. That's a really good point. I like that.
Yeah. The other thing was too, like something where someone's starting out, right? And they might not be as an expert in the industry on stuff, or they're just getting comfortable with something. If they have, a tool that kind of helps them with grading and educating patients, you kind of look like an expert to the patient, right?
Yeah.
But you can also kind of, check yourself in a sense. So as you get more comfortable, it's the same thing when, you do your glaucoma patients, and you come out of school, like, you get comfortable, you know what the next follow-up is, you know what to do next. So you kind of get a same thing with something with dry eye, and it kind of shows you the progression in treatment, and be able to educate your patients on why they need the next thing, or why, this treatment's the best treatment for them.
Yeah. Yeah. Helps you phone a friend too, right? Like, hey, social media team, or hey, colleagues from school, like, what's this, right? Like, I haven't seen this
Correct.
before. What do you do on this, or whatever? Helps.
Yeah, it's a great way to collaborate, I think. And I think it's the future technology, and we need to embrace it. Whether it's something like this, something like an AI or telemedicine, we need to incorporate it, and we need to figure out how we're going to benefit our patients, instead of thinking of the negatives.
Yeah. And that medical model, I can't agree with you enough. Like, there's change coming, and optometry needs to be on the front of the wave there. So hopefully we don't get behind it.
Yeah, of course. Well, I want to thank you so much for taking the time to come on the Facebook Live. I'm sure people have questions, and they can comment under the thread today. But if they want to email you, do you have an email that they can contact?
Yeah, for sure. I'll try and jump on the thread and have a conversation going forward. But Dr. Jake Lang, so Dr. Jake Lang, all one, at gmail.com would be easiest way to reach out to me.
All right. Well, thank you so much for taking the time.
No, thank you for the opportunity, and thank you for doing everything you do for optometry.
Oh, thank you so much. It's my pleasure. Thank you.
Take care.